a little bit about things that you can do either to prevent these from happening at all, or if you have some of these issues and it's not severe where, you know, you're kind of just fighting through pain, then a lot of these techniques and strategies can definitely help. So there's going to be a few things. So the first few slides, we're going to talk about mobility. So the first slide we'll talk about breaking up the tissue. The second few slides we'll talk about stretching some tissues. And then the third group of slides is going to be all about strengthening exercises. So we'll start with the mobility. So this slide kind of just shows you some very basic areas. Most of the time, all these areas, and I'll talk about each one very, very quickly, is needed for a lot of these conditions. But just to kind of go over this, what we're essentially trying to do with a foam roller and lacrosse ball is essentially break up any type of fascial adhesions or connective tissue adhesions through some of these tissues. A lot of times what happens is when these tissues are overworked, they get very, very tight and then they can't do their job. So a few key points when it comes to using these tools. We typically tell most of our patients to kind of work through every area for about a minute. So you can see here 45 to 60 minutes. You never really want to feel any numbness or tingling. So if you do, I would say just get off of that area. The other rule of thumb that I typically tell most people is you're never going to want to be rolling directly on a bone. It's not going to feel good and you're not going to be doing anything. So those are really the two things that you always want to watch out for. So you can see at number 3 here, if you're experiencing numbness and tingling, just reduce the amount of pressure. I would say that's a good tool, or just move over a little bit. Typically it'll go away. You will be feeling a good pain. So you're going to be working through tissue that needs to be broken up. So you're going to know that because it's going to hurt. The only real thing that you can do, quote unquote, to harm yourself is you can bruise the area or you can make it increasingly sore. That typically just means that you probably overworked it. So what you would do is you can use ice to calm the area down, or if it's not that bad, just give it a couple days off or a day off and just stick to the stretching and exercises and don't worry about the foam roller or lacrosse ball in that specific area. And then lastly, obviously make sure you're stable. So you don't want to be, you know, rolling all over the place, fall, and then now cause another injury. And you can see here, there's a couple, these are pretty basic techniques, but again, this is working on your calf, your glutes, the IT band, the quad muscles in the front, and then also the plantar fascia, or essentially the bottom of the foot. And we'll talk about some of these. These are kind of basic techniques of how to do them. So if you're ever doing any of these things and it starts to feel like you're making the issue worse, or if you just can't get to it, the best thing I would say is just kind of hold off on it. Like I say, I'd rather you not do these things or force yourself to do them, and you're just winding up hurting yourself even more, okay? So the next slide, we're gonna start talking about a few stretches. A lot of these are things that you've done in the past or have seen people do. This one is very good. So on the left side of your screen, you're gonna see gastrocnemius or upper calf. That's essentially the bulb of the calf muscle. You're gonna be stretching out. So our demonstrator is stretching out the right side of her body. So the right leg, the right lower calf, or the upper calf. So it's the straight leg in the back. So the key for this one is that the leg that you're stretching out is completely straight. And if you lean forward a little bit towards the wall, you should feel the stretch kind of towards the bulk of the muscle. And then if you look at the right side, that's the soleus or the lower calf. All you really need to do here is what you would do is kind of back off the stretch. You would bring the back leg up a little bit, and then you can see in the picture that her knee is bent then. So it's not a completely straight right leg, it's a little bit bent. And when you bend the knee a little bit and now move forward, you should feel that stretch down through the lower calf and even into the back of the heel or the Achilles. So with both of these stretches, just with every stretch that we give out, you really want to just feel the stretch, hold it for about 15, 20, 30 seconds, really just let the tissue relax a little bit and then back off of it. You never really want to bounce into a stretch. So, a lot of people will do that just to kind of speed things up. I've kind of seen that, if anything, that makes things tighter because you're just not allowing the tissue to relax. So this is a very, very good stretch. And like I say, both techniques are used. So it's not like I would just give out one. I typically give out both of them, so you're hitting both parts of the calf. So the next stretch is for your hip and your glute. So this is a very good stretch. Now, I'm going to kind of switch things up from this slide too, because one thing you can do is you can definitely cross the foot over the knee. So in this picture, the demonstrator is stretching her right hip or her posterior hip or her glute. And you can kind of see here that she's not necessarily pushing the knee down, but what she's doing is she's sitting up straight, kind of just stabilizing the knee and hinging forward at her hip while keeping her back straight. So when you do this, you're not going to be rounding your back forward. You're just going to be kind of hinging forward at your hip, and you should feel it into your glute muscle in the back of your hip. The other thing that you can actually do here is if you're not feeling it or you just feel uncomfortable with your back, is you can start in the starting position and sit up straight and actually just bring the knee across your body to the opposite shoulder. So you kind of just bring the knee and you just kind of cross it to the opposite shoulder. You don't have to bring it very far, but again, what you should feel is that stretch through the posterior hip or the glute muscle. Both will achieve the exact same thing. It really comes down to what feels better and what you're more comfortable with. So the next slide, we'll talk a little bit about stretching the plantar fascia or the big toe. So the first stretch I'll kind of mention is the one to the left. So this is the one where she is standing up. This one you can do against the wall. This one, a lot of times, if you have an acute plantar fascia issue and you're dealing with a lot of pain, this can sometimes be too much. So if you're not dealing with that, actually the one to the left is actually good because you're stretching the big toe, which is vital for biomechanics, and you're also getting a good stretch through the bottom of the foot, and you may even actually feel some things through the calf. Now the stretch on the right side is a little bit more for folks that either the one on the left just feels too much or they can't feel it, or if it actually hurts their foot, or if you have more of an acute plantar fasciitis case, this one is going to be a lot more tolerable. And this stretch is actually very, very beneficial for, again, those folks that are dealing with any type of issues in the bottom of the foot. Doing this before getting out of bed is very, very helpful, so you don't essentially just step on it, hurt it again. It's also very helpful if you are experiencing any type of foot pain after sitting down for a long time. So stretching this tissue a little bit for about 15, 20 seconds, a couple rounds before getting up can definitely help quite a bit. So now we're going to start talking about stretching. So this is called toe yoga. There's a bunch of different things that you can do for your toes and your feet. This looks easy, but it's extremely hard for a lot of folks. I would say for most people, this is pretty difficult. What you're really trying to do with some of these exercises is strengthen the bottom of your foot and your essentially your support mechanism for your arch. Now the plantar fascia is the main support mechanism, but it's kind of like a rubber band where if you overstretch it, you can't get that stretch back. So a lot of times when it's a chronic issue over years and years and years, and it's just never been corrected, you kind of lose the ability to support your arch with your plantar fascia. So what we're trying to do is get you to strengthen the secondary muscle, the secondary support mechanism, which is your muscle. So this exercise is pretty much exactly what you see. You're gonna, I would say, sit down with your feet on the floor and definitely be barefoot. And what you're gonna do is you can do both feet at the same time, or you can just try one at a time. And you're just gonna lift your big toe as high as you can go. And then you're gonna bring it down and try to lift all 4 toes together and just go back and forth. And again, when you get to the top, try to hold it. This is, like I say, very difficult. The more you do it, the better you get. And it's just repetition for this. And then the next set of exercises is this kind of ties into also for plantar fasciitis cases and kind of people with a dropped arch. This is very, very helpful. This can also help out with shin splints too. But again, if you're experiencing shin splints and if you start to feel the pain, just like everything else, I would stop. But this is kind of a neat little spin to your typical calf raise. So what you can do is you can get a lacrosse ball, or you can even just get a pillow, because sometimes a lacrosse ball just hurts pressing into your heel. You just get a pillow, and what you're going to do is you're just going to kind of squeeze that pillow or that towel or that lacrosse ball in between your heels. And then while you do that, you're just going to go up on a calf raise. hold for a few seconds, and come down. What that's going to do is it's strengthening your tibialis posterior, which is essentially the muscle that lines the inside of your shin. So it's not the big muscle on the outside of the shin or the front, it's right in the inside. So when you go up on that, you can hold for a few seconds and you'll feel that muscle engage quite a bit. This muscle is one of the support mechanisms for the arch. So if this muscle is weak, you're typically going to have a flattened arch. So this is kind of geared to just essentially helping you build your biomechanics of your foot and just give you a little bit more stability through the arch. And then we have a lunge, and I believe the next one too is a squat. So let's first talk about the lunge. This is more of a dynamic exercise. So the one thing I would say is if you feel like you're doing it wrong, you're not feeling it in the right spot, it's definitely good to either talk to a friend that does it, talk to a trainer, wherever you kind of have an outlet, or obviously if it's hurting that much, you come see, a provider like us or any other provider you trust. But the key here is that, one, the right leg right now, the demonstrator is strengthening. So the right glute is going to be engaged here. And also we're working on stabilizing that knee. So when you're doing this wrong, and I think it's important when you're doing any exercise that if you know what's wrong, you just avoid that and you're typically doing it right. So the wrong thing to do with this is, one, you don't want to have that front knee over the toes. So if you can tell on the picture on the right, this is kind of the end movement of it. The knee is kind of still stacked right underneath her heel and her toes are in front of it. So that's a proper movement. The other thing that you can't really see here quite well, but I can tell that it's being done properly, is that when she's coming down, the right knee is not diving inward or collapsing inward. So you want to keep that knee just in line with the toes. Because if it starts to come inward, that actually means that you're not stabilizing that leg and the glute muscles aren't helping out. So that's the other key thing for this, that if those two things are happening, you're probably doing more harm than good. So that's why I say if you're doing those two right, you should be in good shape. The third thing that I always say for lunges, and it's trickier when you're doing a forward lunge versus a reverse lunge or a backward lunge, is that when you're coming down, you want to kind of come straight down. You don't want to be, when you step forward, or if you start in the starting position, you don't want to be like leaning forward when you go to the lunge. You want to come straight down. And when you come straight down and push up through that right foot and heel, you're going to engage your glute muscle. Because one thing that lunges typically will do is kind of force you to use your thigh muscle and your quad muscle a little bit more than we want you to. So if you feel like your thigh muscle is kind of burning out, it may mean that you have to kind of shift your weight back a little bit and squeeze that right glute muscle a little bit more. So that's the lunge. And then the second exercise for our glute tissue is going to be the squat. So this is kind of a cool trick that I do like, because it kind of helps you program yourself to go through a squat the proper way. So if we don't have a chair, if we just say to squat, a lot of times we're not going to move through the hip as much as we want to. We typically bend with the knees a little bit more. But when we have a chair there, we kind of give you the the thought process of hinging back like you're sitting into a chair. What this does is it kind of forces you to kind of hinge your hips backwards and kind of move through the hip a lot more than your knee. When you do that, you're going to kind of position your weight more posteriorly. So when you come upwards, you actually are able to squeeze your glute and strengthen your glute muscle, which is essentially what this is trying to do. This is the other thing where you really want to focus on, obviously I want you to hinge back through the hip, which is what this picture shows you. But you also want to kind of use those two things of what not to do, like we used in the lunge. So you really want to minimize the knee coming over the toes. So you can kind of see in that second picture on the right that the knees are still behind the toes. And then you also want to make sure that your knees are not collapsing inward. If they're collapsing inward, again, we're losing that stability of the glutes and you're not really causing any good. You're actually probably causing a little bit more harm. And one of the really kind of cool things that you can do in this drill is you can get a light band and you can actually tie it into a loop and you just put it right above your knees. What this does is it kind of forces you to push outward a little bit to keep your knees outward, to keep them in line with your feet. Sometimes it's a nice way of just triggering the body to engage your glute if you're having a hard time just doing it without anything. But again, if you're going to add any type of band or anything, it should be light and it should not increase any type of pain. If anything, you want it just to feel a little bit more, good activation through the glute. And if you're starting to feel it through the thigh muscle or the front of the hip or the knee, I would just say take the band away, stick to this. And again, like I said before, if it's causing more harm than good, then, talk to a professional, talk to somebody that's done this before, okay? So I believe, so that's it for the strengthening and overview. So I'm gonna kind of hand it back to Jason, and I really appreciate you taking the time to watch us today. And if you have any questions, of course, we're always here for you.
Thanks so much, Dr. Miller. I'm just going to talk a little bit about some of our accountability metrics and what we do at Airrosti. We've treated over 840,000 patient cases at this point, and our average number of visits is 3.2, as I said earlier. So when people do come to see us, if they are experiencing any pain from a variety of different parts of the body, but related to runners and walkers, something that we do see often, on average about 3 to 4 visits is our standard injury to injury resolution time. Some of the stuff that Dr. Miller talked about today can be more personalized to whatever your specific injury is. So say if you are dealing with, something in the calf or plantar fasciitis or something, Dr. Miller or any of our other providers can really pinpoint where the source of that pain is coming from and help, get you back on track to a full recovery. We've been able to prevent over 15,000 surgeries. So we always like to highlight this because if anyone has had a recommendation for surgery, we always tell people that we're a worry-free second opinion. If you were told you needed to get surgery, you can come see us. We can give you a second opinion and either confirm that or say, hey, maybe you are a candidate for a more conservative option. If you are more of a candidate for surgery, there'd be no cost for the visit. It's totally worry-free. And then this middle section is kind of really what we like to harp on. 99.6% of people that do see us recommend us to friends and family, and 88.3% report a full recovery. So about 9 of every 10 people that do come to our offices, we are able to get them to a full 100% recovery. And then, those 11, 12% of people that didn't get a full recovery, maybe they experienced, a lot of progression, but maybe not quite 100% due to some underlying conditions like arthritis, or maybe they just weren't a candidate for our care and we helped get them to the right physician or the right provider. This just kind of covers more of what we do and the types of injuries we treat. So we treat pain from all the way to headaches, all the way down to plantar fasciitis, extremities, elbow pain, all that type of stuff, acute and chronic. So it could be something that just happened, over the weekend. Maybe you were running and hurt your heel. That could be something that we can look at. Or it could be something that's been bothering you for a number of years. Maybe it's been persistent knee pain while running for a number of years, 2, 3, 5 years. So all common things we do see in our office that we are successful in treating. And lastly, this is Dr. Miller's information. He is located in McLean, Virginia. You can see his address and the phone number for him. We also have other locations all throughout Northern Virginia and then also in Charlottesville and Richmond. So we'd be happy to help you out if you are in pain and looking for an option. We're always available. So with that being said, Dr. Miller, thanks again so much. And we hope this video provides you some great information and helps you out of pain quickly. So thanks again. We appreciate it. Have a good day.